My name is Kimberly Petronella. I'm the Health Occupations Coordinator, which means I'm the New Visions Health Instructor and I coordinate the Nurse Assisting Program. I'm also the Work-Based Learning Coordinator here at Oneida-Herkimer-Madison BOCES. I've been teaching here. This is my 24th year. I'm a former student of Oneida-Herkimer-Madison BOCES. I graduated from here in 1988 with my LPN. So I'm truly a big proponent of career and technical education and where it can lead you into the future. I have worked all over the place. I've worked in long-term care, acute care, critical care, emergency care. So I kind of have a little dabble of everything for my career base, for my, I guess we would call them my qualifications. I'm not even sure. Welcome to the New Visions Health Occupations classroom. Actually, this is the lab portion of the classroom. New Visions Health is a senior-only program where students can come and explore different health careers, nameless, all different types of health careers. And they also learn government, economics. We also have English 101 through MVCC with our English instructor. We have personal finance with our math instructor. Both of those are college-level courses where they can earn college credit. We also incorporated medical terminology through MVCC, which the students will learn here, and they can also get 3 credits for that through MVCC. And then we also are doing college foundations. So if they do attend MVCC, that class will be done for them. So they're going to do a lot of college prep work. They also do government and economics in here, and they get their English 12 credit on top of learning health concepts. So it's a very busy classroom. It requires a student to be ready to take on a lot of extra responsibility, but do it in a fun way. It's not overwhelming. It teaches the student how to become ready to schedule themselves and properly organize themselves and prepare them to go on to college, which many of them are. So here in my lab, this is where the students will work with me, and what they'll do is they will learn basic nursing skills. They'll work with their partners, and each of them will take turns learning different basic nursing skills, and then they'll practice with one another, and then they get competencies, which means that's when I watch them do this skill. By working in the lab, what will help them, especially students who are going off to nursing school, PT, OT, any of those programs, they're gonna have a nice basic knowledge base of what some skills are that we do with our patients. So when they go to college, they'll feel more ready, they'll feel more comfortable. So when they go into their labs at the college level, they would have seen that before, they would have participated in that before. I'm comfortable with that, and it might give them a step up versus other students who've never had the lab exposure that the students would have had. So we work in here as often as possible, you know, in between doing all of our course theory work. Then they wear their lab coats. We're both here in the classroom and when we go out clinically. When we go out clinically, we go out 3 days a week on Tuesday, Wednesdays, and Thursdays, and we go out to local hospitals. Hopefully, once the large hospital is ready to go in a few years, we'll be going there, of course, to the larger hospital. We also go to ambulance companies, local nursing homes, a bunch of other different places for internship so that the students can work with professionals in the field and learn how to be successful in those different careers, but also give them a wide variety of different health careers so they aren't pigeonholed into one thing, because many kids really don't know what they want to do. So we're trying to help them find that way, or maybe it will solidify exactly what they want to do. This year I have a bunch of students who are very interested in nursing, so of course they're really into working in the lab and doing all the lab skills. But I also have a bunch of kids who are interested in therapy, and they're really excited to learn all the lab skills too, because those are skills they are going to use when they get out into the world of work. Hopefully, you know, following college. So we do have a classroom side. I can show you that too. So in the classroom side, and this could change, I could be in a whole new room next year, you never know. So for this year, this is our classroom size. The students all work over here. We have Chromebooks, they log on to them. We do stuff both online and in person, because we do both of those interchangeably. So the students will work doing a daily journal, opening up different lecture style notes. We do lecture over here, or actually more I call it class discussion, because we try to discuss together. We do a lot of projects. We just finished doing a debate. So I make sure we do a lot of group work. I think that's very important that the students work together and develop that teamwork skill so that they're able to easily transfer that when they go on to college, and then definitely when they go on into the workplace. We don't really work independently in here. We make sure it's a group effort for everyone. So when we're on this side of the classroom, or this side of the room, this is where all the theory takes place primarily. A lot of our group work takes place over here. When we're in the lab where I showed you previously, that's when we're doing our skill-based activities, our skill-based work. We interchangeably use online and in person, like I said, so the students can feel comfortable, because in healthcare, everything is pretty much gone to the online world, documentation and such what. And that's pretty much my program, what we do here.